This video is to give an idea of what it was like for NHS staff during COVID-19 and COVID-19 patients, as well as what the NHS will be like from here on, as the NHS will never be the same again.
Hospital wards now turned into zones for contagion. Nobody could have prepared them for what was to come.
This is an amber zone, and it's considered an amber zone because we know that there will be some patients here that are positive, but not all of them are, and therefore we advise everybody to wear masks.
St Heliers respiratory ward. The contrast from the intensive care unit we saw yesterday at the Trust's Epsom site couldn't be greater. There it was full protection, head to toe. Today the rules say just a surgical mask.
It was one of the first wards where we had an increase in patients needing respiratory support. And so we turned it into what is called an amber area with a red area.
This is nursing like they have never known.
How are you feeling today?
Oh, much worse than when I did come in. I can't get rid of it.
No.
I can't get the breath there.
Yeah.
60-year-old Rosanna Goodsell had been here for 5 days.
And sitting up is better?
I think that in my mind it's sitting up. If I'm sitting up, I'm all right.
Yeah.
But in my legs and my stomach, no.
No.
Because they're all bloated out.
Yeah.
So,
Okay.
it's just mind over matter.
The patients here in St Heliers COVID wards are not so sick that they need to be in intensive care. How was she?
She's fine. Still feels quite rough, but that's expected.
But the ones we spoke to seemed shell-shocked. Not just their breath, but what had happened to them. And the staff, they don't have time to process this. They just have to get on with it.
We have lots of staff doing things that they'd never done before. So we've got people who worked in ophthalmology, for instance, swabbing staff and in our pods so that staff can get their results back. We have therapists who have just done musculoskeletal stuff, working in ITU, looking after patients in ITU as part of the team. So the response from staff has been fantastic.
And we meet Lillian Bishop-Campbell, a dietitian preparing to go into the red zone with the sicker, more infectious patients to help with lunch.
On a normal day we wouldn't feed the patients because the nurses would have a bit more time, but in the current situation we're trying to help as much as possible.
The staff have had to adapt. The hospital has had to change. They're learning as they go. And they're asking questions. Like the government, which has now announced an inquiry into whether black, Asian and minority ethnic people are disproportionately affected by COVID-19. Well, they'd already noticed that here.
For me, as a BME chief nurse, it's important to recognize, because I recognise it. I know that, BME staff are probably working very differently, with a very different kind of burden in terms of we're here, well, we have families that are hundreds and thousands of miles away, some of them, but staff are just really positive, have been responding, have been coming to work and doing the best that they can do for patients.
Epsom in St Heliers was one of the first trusts in the country to be hit by the wave of COVID-19 patients. Keeping them alive on ventilators, giving hundreds at a time oxygen, they needed new tanks and new piping. It's something you would never think of. A CT scanner in the car park so non-COVID patients don't have to go into the hospital.
Would I be able to get you to show me your movement of your wrist?
Virtual consultations. They've had to reschedule 96,000 appointments.
So we're in one of the operating theatres in Epsom General Hospital. On a normal day, we would have been doing quite a lot of cancer diagnostic and cancer treatment surgery in this theatre. And as you can see, it's empty. The government bought up all of the capacity of the private hospitals. And we have 2 local private hospitals, and we have been sending all of our urgent cancer patients and the urgent planned care operations to them to be operated on.
We've been filming for 2 days now at Epsom and now here at St Helier, and the thing that stands out the most for those of us who spend a lot of time coming in and out of hospitals is just how quiet it is. There aren't the patients and the staff in the corridors. They're all busy on the wards, or they're actually simply not here. They're being kept away.
I was just sitting here like I'm talking to you. If I had a lot of pain on me, I could understand it, but I didn't.
No, just the cough.
It just came and, you know, and it got me there. The lungs. That's where it got me there. Very frightening.
Were you frightened?
Very frightening indeed when they said that you can go. Oh yeah. Oh Jesus. Yeah, it's not a nice thing to be told.
What did they tell you?
You know, when you're told you got that on you. Yeah, but there's not a lot you can do about it, is there really?
You were worried that you would go downhill, that you would...
Oh, I did go downhill quick. I went down a hill a bit too quick for my liking, dear. But I've got very good people around me.
Mr. Smith has been in hospital for 2 weeks. He spent his 75th birthday in here. In a neighbouring room was 89-year-old Brian Mason, a former policeman about to be released after 12 days. What was interesting was these two men had very different symptoms.
I hadn't eaten at home for 4 days, and now I then started eating, and I think from then on I've started feeling that much better.
Were you ever worried that you were going to get even more sick? Did they warn you that you could deteriorate?
Yes. Yeah.
What did they say?
I think you know, kind of it was the fact that they thought that I'd been a bit lucky.
Do you feel you've been lucky?
Yeah, I do. Yeah, very. At my age.
Outside another ward we meet Cheryl Killick, waiting to be let in to see her dying mother. It too is an amber zone, meaning there could be some COVID patients, but the hospital recognises the need for relatives to say goodbye.
And she's been given 24 to 48 hours to live.
And they're letting you go in and see her?
Yes, they said under exceptional circumstances.
Because you don't think it's long now?
Yeah.
So much has had to change, it can never be the same again. The NHS will work in different ways from now on. But life and death, that is a constant.
Yes, and we've just had some news in from Public Health England. They've just issued some new guidance on PPE, personal protective equipment, and they are saying where there are acute shortages and time of extreme shortages, they're talking about the reuse of some PPE, talking about masks, for instance, which could be reused, some types of masks, and gowns. They're talking about maybe replacing them with lab coats or washable long-sleeve patient coats. Now, what's interesting about this is that it is an agreement, really, that there is a problem with the supply chain, and I can fairly well guess this is not going to go down very well with staff who are already worried about the type of PPE that they're having to use, not necessarily at Epsom St Heliers, I mean across the board.
Hi, here I am. I'm back at work. Got my PPE on. Are you sure these cookies are safe to eat now? Ready to... Got to put my visor on as well. Hi, my name's David. I'm one of the intensive care consultants in Anira and Bevan. I just wanted to share with you how I got coronavirus. At the moment, my team in the intensive care unit are looking after a lot of patients who are critically unwell with coronavirus. Some of them are younger than I am, and they're certainly not the frail, elderly people that maybe some of us have been led to believe we would be seeing. They're young, they're fit, and they have young families. As do I. I'd like to tell you that I got coronavirus from heroically looking after some of these patients, but actually the reality is much more mundane. I think I probably caught this from contact with colleagues at work, possibly, and possibly someone out in the street, before any of the coronavirus patients really arrived on the intensive care unit. It started off very innocuously. I had a burning sensation in my nose. I lost the sense of taste. I never had a cough. And then I've had a week of just feeling absolutely terrible, aching muscles, aching bones, and unable to get out of bed, sleeping 16, 18 hours a day. I'm on the mend now, thankfully, I hope. But I can't emphasise to you how sick this can make you. Please, please listen to the advice that's going around at the minute. This is a small sacrifice for a short period of time, and then life will get back to normal again. But we have to protect everybody, and we have to protect the NHS. Ready to go in now to the contaminated part of the intensive care unit. It's great to be back at work, working with all these lovely people around me.
Great to have you back, Dave. Welcome back.
There we go. No, it's great to be back, great to feel better. Really pleased to be able to treat patients again. Really pleased to be able to get back into it. So looks like we're going to have a very busy few months. At the minute, we've breached our capacity in intensive care, so we've got over 16 patients now in intensive care. Our normal capacity will be 13 ventilated patients. And we've gone into the operating theatres now, so we've got another 3 ventilated patients in the operating theatres. So I'm going to put my visor on and see if I can go and help.
If anyone is thinking of taking any chances, just take a look at me. I'm in the intensive care unit. I can't breathe without this. They've had to sew that into my artery. I've got a cannula, another cannula, and a catheter. I'm actually 10 times better right now than what I was before. I don't even know. I've lost count of the days. And you're going to end up here. Okay?
So basically, all the patients that died last night, if you're probably aware, visiting and visitors are not allowed. So.
So I've got 2 runners just helping out with everything. So you've got enough staff. I've got 2 runners that are helping everybody.
I have asthma, so it is scary, but we sort of have a duty to our patients, so it is the split between looking out for my own safety, but then also I'm a nurse. But it is scary, like I'd be lying if I was saying I wasn't scared.
We normally wouldn't even consider how much oxygen we can get into the hospital because we know that normally we don't have the number of patients requiring oxygen therapy, and it's something that we are worried about, that we may unfortunately run out of oxygen supply if we have too many patients needing us.
If it is now necessary to wear a COVID-19 mask when attending hospital, and it is also necessary to have a COVID-19 test. You may be asked to self-isolate in your room until your results come back. For a scheduled hospital appointment or scheduled admission, you may be asked to self-isolate for 2 weeks before and to take a COVID test 48 hours before your appointment or admission. As we saw COVID-19 spread, we all had to stop dead, but the NHS sprang into action instead for victims to be oxygen fed. Sirens wail on an unprecedented scale, how them people could fail, as to shop normally they did fail, as they shopped on a ridiculous scale. song of gratitude, a song of tribute from those who play the harp or the flute, to express our gratitude and amazement. All our words would be an understatement. Oh, yes, we know things will never be the same, but let us hope that sense people will regain, and from poor hygiene they will refrain, as some normality we do regain, so we do not spike again.